A 2-year-old boy is brought to the physician because of a 2-day history of a rash, as shown in the picture. His mother says that the rash initially appeared on his face and neck, and he has had fever, cough, and poor appetite for 5 days. The boy's family recently immigrated from Asia and is unable to provide his vaccination records. His temperature is 102, pulse 105, respiratory rate 21. Physical exam reveals fading of the rash over the face and neck without desquamation, along with tiny rose-colored lesions on the soft palate. Enlarged lymph nodes are enlarged tender lymph nodes are palpable in the suboccipital, postauricular, and anterior cervical regions. Which of the following is the most likely diagnosis? So this is a pretty simple, straightforward question. We've gone over similar questions quite a few times. The options are measles, mumps, roseola, rubella, or parvovirus. So rubella is contagious disease caused by the virus in the Maternaviridae family, and it is eliminated in the US, but it can be seen in immigrants and people with incomplete vaccination records, which was the case in our patient. And it generally spreads through respiratory droplets, and transmission from mother to fetus can lead to congenital rubella syndrome. So postnatal infection presents with low-grade fever, anorexia, lymphadenopathy after an incubation period of 14 to 21 days. So the key to recognizing that this question was talking about rubella would be the enlarged tender lymph nodes in the suboccipital, postauricular, and anterior cervical regions. So most commonly, you will see tender postauricular lymph nodes in rubella, and that is what you need to pick up on. Because the lesions are similar to measles, even the soft palate finding could be confusing, but if you pick up on the enlarged postauricular tender lymph nodes, that would be your key to getting this question right. So postnatal infection presents with this incubation period. Lymphadenopathy is present in the suboccipital, postauricular, and anterior cervical regions. The first specific sign is a red macular rash on the face and neck, and it spreads to the trunk and extremities as it fades over the face and cervical region with no desquamation. And a typical rash may not be seen all over the body at one time as is seen in measles. So that's another differentiating feature, a little less subtle, but the lymph node is the way to go over this question. The rash will last for 3 days, and oropharyngeal examination reveals tiny rose-colored spots over the soft palate known as the Forsheimer spots. So I'm going to quickly just show you what that looks like. And so the rash, once again, I'm going to go over this picture. Just think of paint falling over your body. So it starts at the top and spreads to the bottom, and it disappears in the same order. And if you see here, these are the Forsheimer spots on the soft palate. These are reddish pinpoint spots. Okay, so just keep these pictures in mind and you should have no problem getting these questions.
Thanks for watching. Please give a thumbs up and subscribe for more.